You, you see this, right? Like, you see this? So if I go to my provider and they're like, you have swollen legs, you need to wear compression. This is typically what happens. The great majority of my patients come in the clinic, and when I go through complete decongestive therapy strategies to educate them on what's going to happen, and at the end of that discussion, when we start talking about management, I bring up compression stockings or garments, and their faces go, rightfully so, because this is most of my patients' experience. And in fact, all of you folks out there with lymphedema, for some reason listening to this crazy, stupid video, it's not stupid. I would guarantee 90% of you have had this experience. I would guarantee it. In fact, just comment yes, for real, because I'm just curious out of how many people see this video have had this exact experience, because it is mind-numbingly frustrating, because this should not be happening. Why does this happen? Is it the patient's fault? No, it's not. Most patients are doing exactly what they were told, which was, hey, go get yourself some compression stockings, you have swelling. What the hell does that mean? Do you know how many compression options there are? And you're swollen. This shouldn't be happening. Why should this not be happening? It's very simple. There is a golden rule in lymphedema care. Golden rule. And I will say it's not always followed, because I see it all the time, and it's frustrating for me, but man, pain. The golden rule is you never measure anyone for compression or give them compression garments when they are swollen, because it's going to dig in. The only time, the absolute only time you measure someone for compression stockings or inelastic wraps is when they're reduced, unless you're giving them a reduction kit, which is meant to reduce edema. Other than that, this shouldn't happen. It should never happen. I'm not making it up. I truly am not making this up. Look, if I don't know something, I don't say it. It's good policy. Not making this up. Patients with lymphedema graduate from bandages, that's the treatment, that's complete decongestive therapy, to elastic compression garments once the limb is decongested. I'm like you can read this, you can't read this. To preserve the treatment success achieved during the decongestion of the limb. Did you hear that? To preserve the treatment success. In other words, compression garments have to be worn throughout the patient's life. Because compression garments will not, by themselves, reduce swelling, they must not be worn on an untreated swollen limb. Why? Because when you put them on an untreated swollen limb, that's what happens. Do not allow anybody to measure you if you're swollen. Because if you're going through insurance to get these, you just use that benefit, and now you have garbage. That happens to me all the time. People will come in with referral for me to do my treatment, and they were already measured by the referring provider for compression garments, and they utilize their insurance benefit. So now guess what? Never. Don't allow it.